try to prevent breast cancer, we're still seeing 1 in 8 men and women dying of breast cancer all the time. So when there's a group of people together, you count around and every 8th person perhaps is someone going to be struck with it. And it doesn't matter if you have a family history. That's the key. It used to be that we could all count on, well, my mother's fine, my grandmother's fine, my aunts are fine, I'll be fine, and then at 47 years old, you get a lump. So tonight's talk is not about the dangers of breast cancer and all of that. We want to celebrate hope. We want to celebrate that beautiful pink ribbon, but we want to also educate you strongly on the things that you can do as a consumer of healthcare, as a teacher of your families, as a community member to spread the word on how safe it is to screen the body. And there are some screening tools that have been used for a long time that people just mindlessly go for. So when you hear the word mammogram, how many have had a mammogram? How many enjoy getting a mammogram? Mammography is a screening tool, and that's one of the things that we use. And so we'll talk more in depth about that. But there's a contraption over here on my left, and we have Flower Smith here with us. She's one of our treasured staff. We love Flower. And Flower is our thermographer. So how many of you have heard of thermography? Has that been something recent that you've heard of thermography? And that's because of the advertising that we've been doing, hopefully? Well, thermography is something we're going to be showing you that it's not a crazy contraption or anything. It's just a small little box on a tripod. And it's very, very easy and friendly. So we'll talk more about that. But the first thing I wanted to do was find out from you, how many of you are personally affected in your families by breast cancer? That would be yourself, your friend, your parent. And you see, everywhere we go, we can say that. And it's not just breast cancer, but do you know the #1 cause of death for women? It is heart disease. So even though we're all concerned about our breasts and we're really, really vigilant about keeping them safe, the heart is really what we need to worry about and protecting that. So we're going to talk more about that as well. So today we're just going to talk about, I'm just going to briefly mention the types of breast cancer and what the difference between the estrogen receptor, positive or negative. There's a lot of questions that people always have for me. Oh, I have had cancer, can I still use hormone replacement? And that's why Gordon is going to be sharing with us the safe use of bioidentical hormone replacement. So if you've come for any of those reasons, you're in for a treat tonight. So I did a little review this morning. When I'm ready for a talk, I never really can sleep well, so I got a good review of breast cancer. And what I found was that it was interesting. There's so many different types of breast cancer, and you can develop breast cancer anywhere in the breast tissue, either in a milk gland, in the lobular area of the duct that goes to the milk gland. You can develop breast cancer in the nipple area or on the skin around it. And you can also develop breast cancer in the connective tissue, which is called inflammatory breast cancer. Now, this is a big point I want to make right up front. Inflammatory breast cancer cannot be caught on a mammogram because there's no lump. A mammogram is an X-ray. It only looks for lumps. So if you're someone or you know someone who has a red, irritated breast, it looks like mastitis. If any of you have breastfed children, you know what mastitis is. It's very hot, it's very sore, it's very swollen, and it generally affects one breast. So if you're thinking you have mastitis or your friend is putting hot packs and things, please tell them about thermography. Thermography is the only tool that we have that can tell us exactly what we're dealing with. Okay, so that's the form of inflammatory breast cancer, and it does affect very young women. So young, it doesn't matter, but it really affects the young women prior to the age that they would be recommended to have any testing done, 20s, 30s. The other kinds of cancers that we see can start anywhere. When we call the breast tissue, we look at the breast tissue from the neck bone down the armpit like a big square. This is the chest wall, and anywhere here can grow a cancer. But it isn't about finding it it's about preventing it and learning the things that we can do, that even if you were to find something early on, we have the know-how and the willpower to do something about it. And that's what I wanted to share tonight. Now, breast cancers, when they're found, mostly it's on a mammogram. And then you're sent back for another mammogram, and then they want to do a needle biopsy. So you can see there's a lot of invasion that happens right out of the gate. And if you've experienced breast cancer yourself or walked a loved one through it, you can tell how scared they are. And they're just shuttled from one office to the next office, and then they're stripped down again of their clothing, and the next thing you know, they're putting a mark on their breast, and they're putting this big needle into the mass and pulling some tissue out so they can get a pathology report. So scary. Many times this is done for nothing. Many times. Oh, don't worry, you just have a cyst. Oh my God, I had myself dead and buried. Right? Right? Because they just made this big deal about bringing me back to the mammogram center and getting this done. So this is one of the things that we have to really look for. When someone's diagnosed with breast cancer, they're going to have a pathology report that is staged and typed and told whether it's hormone sensitive or resistant. Not really resistant, it's hormone positive or negative. There are receptors that are on the breast tissue. If the tumor has receptors for estrogen, and when they've taken it out and they look at it, they can see those receptors. They call them estrogen receptor positive. That means that estrogen fed or potentially fed that tumor. If it's estrogen negative, that means that it didn't. And that's even nicer for us who want to use estrogens later. But progesterone can also, there's a receptor on the tumor, can be progesterone positive as well. And so it's important to know what type of breast cancer your loved one had or you have had before you go to your provider seeking the safe use of hormone replacement. That makes sense to you. Okay. Okay, so let's go back to how would we monitor for breast cancer? Well, how many were taught when you first developed your breasts by someone taught you how to do a breast self-exam? How many really did it consistently, right? Who wants to find something wrong with your breasts? I mean, we're told to do a breast self-exam by using, the pads of the fingers. Well, they're not even recommending that anymore. Did you know that? So if you're doing your self-breast exam every month, they're saying don't bother. It's too late. If you found something, it's too late, right? Well, now women are going, wait a minute, I should have been doing it all this time. What if I don't even know if I have one? Well, this is why we want to recommend. We want you to do all the things to prevent the breast cancer. We want you to reduce the intake of the meat, the dairy. We want you to reduce the intake of alcohol because it's sugar. Okay, that's one thing that people separate out. They go, well, I don't eat any sugar at all. I don't eat starches, carbs, but I love my wine. You're not taking my wine away. And I was like that. Okay, sugar. The largest ingestion of sugar in women is alcohol. And there have been many, many studies that have shown the increased risk of breast cancer from a regular alcohol intake. So when we're going about our day and we're learning about prevention and we're told that there's certain ages that we need to do this, and we know at 50 we get the big colonoscopy recommendation, but what age do you think it's feasible to start testing or screening for breast cancer in men or women? See, 40 is what they used to say, right? Have you seen the new regs? The new regulations now state that they won't start screening until 50. And they don't want to screen but every 2 or 3 years for a mammogram. Do you know why? Because the radiation is very, very cumulative, and they have not shown a decrease in the mortality rate by screening. So here we are, our insurance companies are paying for mammograms every year, starting from age 40. You're supposed to have a baseline at 35, and then have a yearly mammogram until, from 40 on. Well, some of the statistics had shown that at 30 lifetime mammograms, the accumulation of radiation was enough to stimulate the breast tissue to develop a cancer. So they know this. So now they're backpedaling to say, whoa, we've got to decrease these regulations. But what is someone to do when you know that the foods we eat are not perfect, when you know that we're not eating organic all the time, we can't be perfect, what are we going to do to screen our bodies if our insurances or they're telling us, no, you can't have a mammogram but every year? This is where we're going to talk about thermography. So we can put thermography into our screening plan to do any time we want, because there is no radiation. We don't even touch you. So I just want Justine, if you would be our little subject here, I want Justine and Flower to get together, and I want to show you what a thermogram looks like. And what we're recommending is thermography starting at age 25. 25 years old. I've even heard of people getting breast cancers younger than that, but that's usually with the family history and things. But age 25 for a man or a woman can get an annual thermogram, and we start by taking only 5 pictures. Now you see that there's just that much distance between Justine and Flower. She's never going to touch her body, and there's no radiation coming from the machine. This is a camera that detects heat. Now, Justine would have to be naked from the neck to the waist, but she's not going to do that. But what she will do is drop the gown down to her waist, so just take the gown off your shoulders and down to your waist, and then put your arms up, and Flower will show you, and that's the position we do the thermogram at. We take 5 pictures. That's it. So after a little bit of a history, you just come in and get 5 pictures in different poses, and then you come back in 3 months and get it done again, the same 5 poses. The reason why you're going to get it done in 3 months is we want to make sure there's nothing active going on in the heat coming off your body, because if there's an active process, we can catch it right then. But say it looks identical to the 5 pictures you took today in 3 months, then the doctor who reads this test says, this is your thermal thumbprint. This is excellent, it's negative, everything's good, we use it as a baseline. That is your lifetime baseline. That piece of information becomes your medical record. If you are not a patient in our practice, you don't have to be a patient in the practice to utilize the thermogram. So if you want to come and get thermography and teach your friends about thermography, please call, come and do it. Flower loves to do these thermograms. She'd love to be busier doing them, but it's so simple. And not only do you do breast thermography, you can do the whole body, the entire body from head to toe. And I think we take how many pictures? About 35 pictures of the body to detect inflammation. Oh, insurance does not cover it yet, and this is what's the interesting part. We don't know when they're going to cover it, but it is a screening tool just like a mammogram. Mammogram is a screening tool, it's not diagnostic. But the normal price for thermography is usually $150 per the set of 5 shots. Any one part of the body is $150. That's the way it is standard across the world. Thermography's been around for 30 years. It's just local now because we bought a machine. But in our practice, if you're a patient, and also anyone who's attending the seminar tonight, we're going to give you a card because we're taking $100 off. So it would be $200 paid up front, pays for both of your 5 pictures now and 5 pictures in 3 months. That's the price. So it's $200. And if you wanted to do the full body, you could do, for an extra $150, you do the full body first and then come back and get the breast included. And that there's no extra charge for that. And that is very telling because there's a lot of people that walk around in fear if they have cancer, or they don't know it, or they just want a clean bill of health and say, let me start fresh. I'm going to change my way of eating, I'm going to change the way I exercise, I'm going to change the way I think, but I just want to make sure everything's good. Okay, so that's what this thermogram is, and if you can see up here, it is literally used for imaging pain. So if people have sciatica or they have a pain in their leg, we can tell the difference between a blood clot or a blocked artery or a nerve impingement or fibromyalgia. We can actually diagnose fibromyalgia with this. Carpal tunnel, you can see it. It heats up. There's no way that these things can be negative. And that's the other advantage. You have a great article, and I want you to read it in its entirety when you get home. It's in the pink sheet. It is Dr. Northrup, Christine Northrup, did an article recently on the benefits of thermography, and she can do a better job of explaining to you why. So I want you to read it and share it with a friend. Yes?
Will this detect DCIS
Yes, it does. Yes.
and lumps?
Everything. Because it will delineate the difference between something serious, like you know all those positive mammograms that you get and you have to go back and then they find out that it was just fibrocystic breast? This will tell you from the first shot, it's fibrocystic breast and you're good to go for 3 months. We'll see you in 3 months. You don't have to go back for more radiation, more compression, a possible biopsy, and so we can tell the difference right away.
Okay, and calcifications, can you tell whether it's benign or malignant?
Yes, because the body will tell with the heat. Yes, if there's any new blood vessels being formed, it will catch it early. There's such an incredible, if you really learn about it, you'll be amazed.